COVID rates are rising this summer, and the city's data shows hospitalizations here over 20% higher than they were last month, which is also higher than the rest of the country. Since it's the summer and so many people are outside, this pattern may seem unexpected. Dr. Ayman El-Mohandes is a pediatrician and epidemiologist and the dean of the CUNY School of Public Health. He joins us with more details and tips on how you can keep yourself and your family safe. Welcome, Dr. El-Mohandes.
Hi, Erin. Nice to be with you again.
Yeah, so we're finding this out because of surveillance of wastewater in the city and also the few people that are still testing themselves. But why are we seeing this rise in COVID cases?
Well, we've seen a similar surge last summer. And, this is summer, it's hot. People are doing more things perhaps indoors in larger numbers. And as you reported, we are seeing almost 25 hospitalizations per day, which is approximately 24% higher than it was before this surge. And it's a little bit concerning because it's almost double the increase that we're seeing nationally. But we are in New York after all, and we're in a big metropolis, and people are active and tourists are coming. So I think the Department of Health wisely just alerted people to keep an eye on these numbers and be careful.
I mean, some people are viewing COVID now as just another cold. How should we be viewing it? There are still people who are vulnerable.
There's no question that people are still vulnerable. And although New York can pride itself in one of the highest percentages of people that completed the primary series of vaccination, people are lagging behind in getting the booster. And to be honest, even in high vulnerability in populations above 65 years of age, the booster is about only 30%. So there's still a very large number of people who are vulnerable and yet not boosted. And we know that people who are immunized and boosted during the springtime were less likely to get infected, almost half as likely to get infected than people who received the immunization series even complete. So the booster does have a protective effect.
There's going to be an updated booster coming out in the fall. So should people just wait till then, or because we're seeing this rise?
I don't think so. I mean, these new mutants are happening because of transmission. And the more we allow transmission to happen, the more we're going to get new strains. And the strain that's coming out in the new vaccine is B4 and B5. We're already in XXB5 and B11. So we are ahead of the mutant strains that have been used even for that new booster. So the advice is be careful. If you're infected, stay home, test yourself, and definitely go outdoors, do outdoor things, and avoid crowds.
Yeah, but other steps people should take to protect themselves. People are pretty much done with masks at this point.
I don't think so. I think that you should use, I mean, we have been through this many, many times. And we know that in situations where there's crowding, especially if you are vulnerable, elderly, immune compromised, take extra precautions, avoid crowds, and be sensible in using a mask when you think it's going to protect you.
Real quick, I would love to switch gears and talk about new recommendations from the CDC for babies under 8 months old to get this brand new RSV vaccine. Yeah,
over 8 months of age, babies can get the new vaccine. It's a little bit interesting because it's a monoclonal antibody. So your immunity is boosted immediately when you get this shot. And it's between 8 months and 2 years. RSV, respiratory syncytial virus, is a respiratory infection that's responsible for the majority of hospitalizations in this age group. It's in the fall and the winter, so this is the time once it is approved to get the immunization, and I think it's going to make a big difference.
Well, I hope that we will see those numbers come down of kids having RSV. Dr. El-Mohandes, thank you so much for coming on set with us to talk about this.
It's always a pleasure, and stay healthy.